How can I use this app? Before proceeding to the femur osteotomy, accurate registration procedure is mandated. Registration phase. A green-colored marking sphere appears by touching any point over the screen in augmented reality during registration. The powerful undo feature gives the user the freedom to make corrections without resetting the whole procedure. Femoral registration. Following surgical exposure and once the surgeon has finally approached patient's femoral head, which is dislocated from the acetabulum, registration is followed by the above-mentioned technique. A registration of femoral head and femoral neck. 4 anatomical points at marginal circumference of femur head should be selected, aiming preferably to the most distant from each other poles of the femoral head: north, south, east, west, C1, C2, C3, C4. Each time by pressing the screen during registration, green spheres appears at pointer tip in AR. By the registration of the last point, C4, a magenta sphere appears inside a blue sphere which overlay over the circumference of femur head, depicting the center of femoral head, or the center of rotation of femoral head, C point. With the same manner, aiming preferably at the marginal circumference of femur neck head, at the most distant part of the neck, 4 points, N5, N6, N7, N8 are selected and registered by pressing the screen during each time. A yellow cylinder appears overlaying the real femur neck. B. Registration of trochanters major and minor of the femur. By touching the probe over the anatomic geometry of points of interest and registrating 3 points instead 1, improves the accuracy of registration. By touching with the probe around the ridges of each trochanter, first the major and then the minor, T and T points are registered. Registering 3 points around that trochanter major, namely T9, T10, T11 in circumferential manner, a magenta sphere appear in the centroid of these, T point. By repeating the same technique, T12, T13, T14 are selected for trochanter minor with the same manner. T point is depicted also as magenta sphere in the centroid of these. By selecting 1 point at the lateral aspect of femur epicondyle and 1 at the medial aspect medial femur epicondyle, registration is complete. A colorful cylinder appears, court, starting from the center of femoral head, C point, to the trochanter minor, T point. The core distance is depicted numerically in mm as LL, leg length, over the screen. The alternate color is helpful and act as a ruler in augmented reality. Each color represents certain distance in mm. The interval between 2 overhanging blue discs corresponds to the actual 10 mm distance, between blue and green disc 5 mm, and between smaller discs in tandem fashion between different color 1 mm respectively. A red hazy plane appear perpendicular to yellow cylinder depicting in the femoral neck the point of intersection between the planes. By pressing the plus or button you can adjust intraoperative and augmented reality the exact resection level of the femoral neck you plan and see simultaneously where resection level should be, depicted by the moving red plane in real time. The red plane intersect the cylinder, leg length, distance from femur head C to trochanter minor T, and a value is printed in screen which represents the desired femur neck resection distance in mm, osteotomy length, distance from trochanter minor to the intersection of leg length to red osteotomy plane. By pressing the button or plus, the osteotomy length can be adjusted in real time with the measured osteotomy length and preoperative planning accordingly. By default, the osteotomy length distance begins with 0 starting from trochanter minor, T point. In screen, head diameter of femoral head in mm, neck diameter of femur neck in mm, leg length in mm, femoral offset in mm, femoral anteversion in mm, osteotomy length mm, and cut depth in mm are shown. By pressing the button or plus, the osteotomy length can be adjusted in real time with the measured osteotomy length and preoperative planning accordingly. By default, the osteotomy length distance begins with 0 starting from trochanter minor, T point. Bone saw cut navigation. Once the position of the coronal plane of femoral neck resection is defined and a red hazy transparent osteotomy plane is depicted, coronal, passing through the femoral neck constantly in augmented reality. By pressing the go button, 3 perpendicular planes around the saw blade appeared with different hazy transparent colors: sagittal blue, coronal red, transverse green in augmented reality over the tip of the bone saw blade's extent ending over the blade span dimension. The coronal plane, Red hazy transparent plane is depicted passing through two red spheres constantly in augmented reality which are extending at the edges of the blade. A green transparent plane, transverse plane, passing through the green spheres, perpendicular to previous transparent red plane, coronal, is depicted in augmented reality. Likewise, transparent blue plane appears, sagittal plane, passing through two blue sphere, perpendicular to previously planes. The cylindrical tip pointer of the iPhone case probe is inserted and fit into a specially designed cylindrical slot, which is situated over the back surface of the oscillating bone saw cutting machine orthopaedic power tool and impacted securely, which is attached at 16.5 centimeters away from the tip of the center of blade. Surgeon can view a gray cylinder between two red spheres, rod image superimposed in the real surgical field through the iPhone display mimicking the length of the blade. The direction of the iPhone case with the rod should be turned manually clockwise or counterclockwise and adjusted accordingly, so the gray cylinder between two spheres shown in AR should be aligned with the axis of blade saw in the middle. Also, Greek capital letter beta Y pressing the plus or button at L button. The length between the tip pointer of the iPhone case probe at the bone saw cutting machine orthopaedic power and the tip of the center of blade can be adjusted accordingly and calibrate every osteotome. Now the surgeon can obtain positional information in real time in augmented reality of the blade saw and the direction of the intended bone cut at femoral neck. Over the screen in real time, three angles corresponding to the direction of saw blade are depicted. For simplicity reason, every color of a plane corresponds certain direction. More specifically, the row with red tile by red tile represented the angle subtended by the coronal plane of the blade saw, red, and coronal osteotomy plane, red. The row with green tile by red tile represent the angle subtended by transverse plane of the blade saw, green, and the coronal osteotomy plane, red. The row with blue tile by red tile represent angle subtended by sagittal plane, blue, of the blade saw and the coronal osteotomy plane, red. Angle values in real time are printed in colors in screen. Whenever the values fall outside the normal ranges, angle values are printed in red color so the surgeon can be guided more easily, seeing screen indications in real time and directing by hand the bone saw blade accordingly more precise, thus avoiding not optimally cuts of femoral neck resection in space. These angles are helpful for accurate navigation of the blade saw in ideal position. Manipulating the oscillating bone saw cutting machine orthopaedic power tool in real time, the surgeon, values of all above mentioned angles change respectively. Obtaining positional information and direction with accuracy in real time in augmented reality by observing the screen of the iPhone. The surgeon can be directed by augmenting his vision reality by readings, the app's calculation, and perform resection osteotomy of femoral, the neck accurate, without mislead by plain subjective plane vision, and simultaneously also adjust intraoperatively in real time the osteotomy distance objectively, according to measured preoperatively planed osteotomy distance. By monitoring live the depth of the cut, the surgeon can't be misled by wrong perceptions, so can predict where to stop cutting during handling with the reciprocating oscillating saw without accidentally injuring neuromuscular